Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Briumvi vs Ocrevus, how do they compare? Key points. Briumvi, Ublituximab, and Ocrevus, Ocrelizumab, are two injectable medications that may be used to treat multiple sclerosis in adults. Briumvi and Ocrevus are both B-cell therapies and work the same way. Head-to-head trials directly comparing the Briumvi and Ocrevus have not been conducted, making it difficult to definitively determine which is more effective. Both Briumvi and Ocrevus carry a risk of infusion reactions and infections. Briumvi, Ublituximab, and Ocrevus, Ocrelizumab, are prescription intravenous, infusions given to treat relapsing forms of multiple sclerosis, MS. Ocrevus is also used to treat primary progressive MS. While there have not been head-to-head comparison studies in patients with MS, both medications work well and have similar side effects. In this article, we will review some similarities and differences between Briumvi and Ocrevus. Briumvi. Ocrevus. Manufacturer. Therapeutics Incorporated. Genentech Incorporated. FDA approval. 2022. 2017. Active ingredient. Ublituximab. Ocrelizumab. Approved uses, relapsing forms of MS. Relapsing forms of MS, primary progressive MS. Drug class. CD20 monoclonal antibody. CD20 monoclonal antibody. Routes of administration. Intravenous infusion. Intravenous infusion. Briumvi and Ocrevus have similar and different uses. Both Briumbi and Ocrevus are FDA approved for relapsing forms of multiple sclerosis. This includes clinically isolated syndrome, relapsing-remitting disease, and active secondary progressive disease. However, Ocrevus is additionally approved to treat primary progressive MS. Ocrevus was FDA approved in 2017, while Briumvi was approved in 2022. Both medications are currently only approved in adults, since there haven't been enough studies in children to know if they are safe or effective. Briumvi and Ocrevus work the same way. Briumbi and Ocrevus are both monoclonal antibodies that target parts of the immune system that are believed to play a role in MS. Both medications attach to and decrease B cells expressing CD20 on their surface. These cells are thought to cause damage to nerve cell coverings in people with MS. Briumvi targets a different part of B cells than Ocrevus, but there haven't been head-to-head studies comparing the two medications in terms of how well they work to treat MS. Related questions: what are monoclonal antibodies? Is Kesimpta better than Ocrevus? How much does an Ocrevus infusion cost? How well does each medication work? There have not been head-to-head trials comparing Ocrevus and Briumvi. However, separate studies evaluated how well these medications work to treat MS. Ocrevus. In studies of patients with RMS, up to 83% of patients taking Ocrevus were relapse-free at year 2. In a 120-week clinical trial of patients with PPMS, those taking Ocrevus were less likely to have a 12-week confirmed disability progression compared to placebo. Briumvi. Briumvi was studied in 2 clinical trials that included more than 1,000 patients with RMS. Briumvi reduced relapses by up to 59% when compared to teriflunomide. Briumvi and Ocrevus have different dosages. A healthcare professional must administer Briumvi and Ocrevus. Both medications are given as an 4 infusion. The dose is different depending on which medication you are taking. Briumvi is first given as a 150 mg 4 infusion, followed by 450 mg 2 weeks later. Then, 450 mg is infused once every 6 months. Ocrevus is first given as a 300 mg 4 infusion, followed by another 300 mg infusion 2 weeks later. Then, 600 mg is infused once every 6 months. One notable difference in dosing between the two medications is that Briumvi has shorter infusion times compared to Ocrevus. For the first infusion, it takes about 4 hours to infuse Briumvi. The remaining doses are infused over about 1 hour. This is compared to around 2.5 hours for the first 2 infusions of Ocrevus, and 3.5 hours or longer for any additional infusions. Briumvi and Ocrevus have similar side effects. The most common side effects of both Briumvi and Ocrevus include infections and infusion reactions. In clinical studies of Briumvi, 48% of patients taking it experienced infusion reactions. Additionally, 45% of patients taking Briumvi reported an upper respiratory tract infection. In comparison, 40% of patients taking Ocrevus for relapsing forms of MS in clinical studies reported an upper respiratory tract infection, and 34% had an infusion reaction. Other side effects reported by patients taking Briumvi or Ocrevus were lower respiratory tract infections and pain in arms or legs. These are not all side effects possible with these medications. Follow up with your healthcare provider to learn more. Ocrevus has a warning about cancer. During clinical trials, more people taking Ocrevus developed breast cancer. In females taking Ocrevus, 6 out of 781 developed breast cancer. This is compared to no females out of 668 taking rebif, interferon beta-1a, or a placebo. More research is needed to know if Ocrevus raises the risk of breast cancer. This is not all of the information you need to know to take Briumvi and Ocrevus safely. Talk to your healthcare provider to learn more. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.